founder and CEO here at Centric Physicians, and we are a physician group that provides both primary care and behavioral health services to patients who reside in the post-acute space. What this means is patients who live in nursing homes, patients who've had recent surgeries who go to a facility to have acute rehab services, patients that live in assisted living, and even patients that happen to be in what we call a long-term care hospital setting. So we actually provide services in the greater San Antonio area, El Paso, and then in the greater Salt Lake City area, and then in Casper, Wyoming. So started in around the end of 2014, and since that time we've actually been blessed and been able to really grow over the past 6 years into a really what I would call a medium to large physician practice. One of the things that I really want to try and accomplish through these little podcasts are really trying to get some education and information out to the public. I feel like the post-acute space is not very well understood by most people. And a lot of times what happens is we have our parents or other elderly people, and by elderly, generally I'm referring to the geriatric population. We consider that age 55 and above. Generally they're doing pretty well and something happens. They get an illness or they fall, they break a hip and they sustain a fracture. They go to the hospital, and unfortunately after the surgery they just aren't really able to go home and get around like they normally would, and maybe there's no family that can help them, and so they actually need to go to what we call an acute rehab facility, where the physical therapy will work with them for several hours a day on getting them back up on their feet, getting them to where they can walk independently and they can toilet themselves, get up to eat and feed themselves. So a lot of times what happens is nobody really understands how that process works. So they have a family member that's in the hospital that suddenly the case manager at the hospital is explaining to them that they need to go to one of these facilities, and they're asking them to pick from a list, and they have no idea what they're picking or where they're picking or what they should be looking at. That's one of the things I definitely want to be able to address, is get some more information out there so people can make informed decisions or understand what the process is before they're in that emergent situation. I also want to really be able to delve into some other topics that I think are quite important in this patient population. Some of those issues include dealing with DNRs, which are code status. So really trying to have open and honest conversations. And how do we do that with our loved ones and our family members to figure out what is it they want? If they were found down or they were found unresponsive, do they want to have a tube placed in to help them breathe? Do they want CPR? What are their wishes? And getting those known ahead of time. Along with that also comes pretty in-depth conversations about dealing with what we call power of attorney or guardianships. These are situations when if you are down and you can't make a decision, the medical personnel need to know what your desires are, or they need somebody who can speak on your behalf if that person never even knew what your desires were. So kind of looking more into those situations and figuring out how do you go about assigning someone to be a power of attorney, or if you have a parent or somebody that you feel like isn't capable of handling their finances anymore, making medical decisions, how do you go about getting a guardianship, or what does that process look like? I also really want to talk about transitions and levels of care. I think that's one of the newer topics that's really come on the scene more recently. We're seeing more and more of what we call CCRCs, and these are age-in-place facilities. So they actually have where patients can go and live in apartments or sometimes townhomes and live independently. But as their situations change, they have on the same campus an assisted living where they can go and get a little more help, or they have a healthcare facility. And typically most of these now also have dementia units where patients can transition to if they need to. So really want to talk about those. What are the benefits of them? What are the setbacks? And overall on all of the options, really want to be able to talk about finances. How does that work? Who pays for what? Is that a Medicare benefit? And then talk also about how, if you do have a house, if you do have other income that's coming in, how are patients able to afford whenever one of their loved ones, say a spouse, needs to go into a higher level of care? How does that work? If you have some property or other things, how do you create Miller Trust? How do you go about doing that so that you won't have to drain all of your resources to be able to support that person, so that both of you can live a comfortable life? So really want to get into some of those topics. Also, I really think it's important whenever you're getting to know the company here, Centric. I just love talking about all the things that we offer here, and I want everybody to kind of understand the background that I'm coming from. So after I actually went to school here in San Antonio, graduated from high school, and then went to Trinity University. From there, I was blessed to be able to go to UTMB Galveston, where I got my medical degree. And then I was actually, throughout medical school, I was on a military scholarship. So I went straight into active duty from UTMB and did service with the military, and actually retired out of the U.S. Air Force in 2004. Came back to San Antonio and was able to be in a clinic where I was doing outpatient care, but also got exposed to nursing home patient care, and just fell in love with it immediately and felt like it was a very underserved population. A lot of the physicians that actually go to the nursing homes typically are hospitalists that work in the hospital, and then on their days off they might go to the nursing home, or clinicians who have an outpatient practice like I had at the time, who then go in their evening times, or if they have a patient cancel or something, they're able to run over there. But I felt like it was sort of an afterthought, and I don't mean that in a bad way. I just mean I feel like it wasn't their priority. Their clinic was, or their hospital census was the main priority. And so I really wanted to focus on having a group that spent all of their time in the nursing home. So around 2009, I met a group that was doing something similar to this with the primary care part, and worked for them until I founded this around May of 2014. Really start kicking everything off in June and July of 2014, and then since then have really grown and progressed. Really the mission from the get-go and the set out was to provide quality care to the residents in this post-acute space, and to honor them in their wishes, while providing care that consistently met the standard of care and was cutting edge, and how to integrate technology into the way we were seeing the patients so that we could offer them the best services and that would lead to the best quality of care that I felt like they could have. Since that time, we also realized that providing primary care wasn't all that we needed. We really found that a lot of our patients suffer from anxiety, depression, and dementia. And that's another topic we're going to be talking about, is dementia, because I feel like if you Google dementia, it's really easy to find medications that you should take or other things, but there's not a lot of information about the different types of dementia. There's also not a lot of information about the progression of the disease, what to expect as a caregiver, where your patients or family members or loved ones should be placed, or how you pick an appropriate place for them. And there's a lot of lingo out there right now about memory care units. So I really want to delve into what is a memory care unit, what does it offer, would it be helpful for that patient? And then also we're going to have Dr. Jesus Randa that comes and kind of talks to us a little bit about the dementia process itself and how it progresses, but also about getting patients capacity tested. So it's really important. A lot of times patients start complaining that they're getting forgetful or they're having trouble remembering things. And so through our group, we are able to do complete neurocognitive testing, which gives you a baseline, and you can, over the years, figure out how quickly your loved one is progressing in that cognitive decline and be able to find an appropriate level of care for them, but we can get them the needed services. And then that also leads into, how do you have conversations, hard conversations with your loved ones, especially as they're cognitively declining, about the fact that maybe they shouldn't be driving anymore, and how can you work with your primary care physician on getting that coordinated so that you get the DMV involved and other people, so that they realize it's not just you being the bad guy taking the keys away. That's really important to have those hard conversations, though, because it's not just their safety, it's the safety of everyone else, especially as reaction times start to slow down, or people start to get forgetful and they don't remember exactly where they're going. So those are other topics that are definitely going to be coming along. You know, my vision kind of for this, like I said, is to really just get some education out there for everybody. I want people to be able to use these as a resource. And as I've seen right now, there's nothing really out there on the internet that kind of guides you through this whole process, or really helps explain what's available or how you access these resources. So we definitely want to be able to provide that and be able to link people up with resources that are out there about the Alzheimer's group, about other groups, that Meals on Wheels even, that help our residents, these patients that are either homebound or that are in nursing facilities or that have chronic diseases that keep them disabled and in the hospital setting. As a final thing, one of the things we do uniquely in the San Antonio area that we don't do in any other market is we do have outpatient clinics. So we have 3. One is at the Army Residence Center. That's more confined just to the residents of that campus. But we also have a clinic in the Stone Oak area, which is north part of San Antonio, and then Bernie, which is just northwest of San Antonio. Although we tend to focus on geriatrics in these clinics, we actually see 18 and up, and we also do behavioral health. And in behavioral health, I mean, we have a psychiatrist that's on board, we have psychiatric nurse practitioners, we have neuropsychologists that do capacity testing, they also do neurocognitive behavioral therapy, and they do testing also for ADD and other mental illnesses and diagnosis clarification. So when someone says that they have dementia, it's really important to distinguish what type of dementia they actually have so that we can use appropriate medications and treatments for those patients. So they do that. And then finally, we have counseling services. So patients who have depression, anxiety, anything like that, that they want to be seeking therapy on a routine basis, we do offer that. And then of course we offer primary care, so we do women's health, and like I said, from 18 and up, we're really happy to take care of patients that have any outpatient needs that we can fulfill. So like I said, we kind of do the whole gamut. Really interested in getting to hear from everybody, get to see comments. I'm hoping in the future we can actually do some live events too, where we can take and field some of your questions and comments. I think that's going to be further in the future as we progress along, but looking forward to doing interviews. I think you're going to be surprised by a lot of the guests that we have coming on, some of the experts in these areas that I've talked about that are going to be able to give you some information and answer some questions that I think everybody's had. So looking forward to getting to get to know each other a lot more over time, and looking forward to getting to do more of these little podcasts with you guys. Thank you so much.